It's wonderful to see so many of you here with us this morning to learn about the resources and support available from our vendors and from our presenters today. My name is Justin Lees, and I'm the CEO of Coastline. We're an organization that helps connect older and disabled adults to the care and resources needed to continue to live independently. We're thrilled to be partnering with the Bristol County District Attorney's Office once again to host this important event. We have more than 70 vendors here today and an exciting lineup of speakers, so I'm just going to jump right into it and get us started. I invite you all to continue to enjoy your wonderful breakfast as the speakers are presenting. Our first speaker today is Bristol County District Attorney Thomas Quinn III. With over 25 years of prosecutorial experience, including 8 years as Bristol County's first Assistant District Attorney, Thomas Quinn was appointed DA by Governor Charlie Baker in January of 2015. In this role, he has established himself as a leading advocate against elder abuse, domestic violence, and in support of youth crime prevention in the Commonwealth. DA Quinn created a first-of-its-kind elder abuse unit to prosecute those who financially and physically abuse the elderly in Bristol County. He has increased the use of dangerousness hearings to keep violent criminals off of our streets, and he is committed to reducing gun violence, gang activity, and drug trafficking in Bristol County's 20 towns and cities. So please welcome Bristol District Attorney Thomas Quinn III.
Thank you very much. Good morning. As introduced, I'm District Attorney Tom Quinn. I really want to welcome you here today. It's been for our 6th annual celebration of seniors. It would have been our 9th, but for obviously the health crisis last few years. So we haven't been together at this event for 3 years, so I can't tell you how happy I am to see everybody here in good spirits so we can acknowledge how important our seniors are to our communities and to me. I think back after I became district attorney, our seniors have given so much to our communities over the years. You people have raised families, made our communities what they are. You deserve to be protected. It's like a political event. You gotta you deserve to be protected, and that's what I've done by creating an elder fraud unit focusing on prosecution and prevention. So it's great to be back here today. Special thank you to Justin Lees, who you just heard from, Ann McCrillis, Zachary Boyer from Coastline Elderly Services, and Eric Poulin, Executive Director of the Rochester Council on Aging, for assisting my office in putting this event together. I would like to give a special acknowledgement to Ann McCrillis. I don't know if she's here, for over 25 years of service. She's retiring at the end of the year. We've had a great partnership. I want to thank her for her service. Also like to acknowledge New Bedford Police Chief Paul Oliveira, who is here taking a few minutes to drop in and show his support for what we're doing in our senior citizens. This is very important today to probably primarily to re-engage, right, for 3 years, get people together. It's a great crowd. Again, I couldn't be happier because I believe all citizens in Bristol County, especially our seniors, need to be safe and secure in their communities. Nationally, an estimated 5 million people are victims of elder abuse, neglect, or exploitation each year. One third of these involve financial abuse. It's probably more than that, too. My hope is to reduce these crimes through investigation and prosecution on the one hand, but prevention and education on the other. We have a number of stations and people here today to provide you with information. We encounter all types of abuse: physical, sexual, financial, identity theft, and neglect. I will aggressively and have aggressively prosecute these people who prey on our seniors, but a number of these crimes can be preventable when people are educated and informed, and that's what we're trying to do. We'd rather have you avoid a scam than say, give $5,000 of your hard-earned money that you will never get back. So today I couldn't be happier to have seniors, caretakers, and service providers in attendance to learn how to prevent abuse. It's reprehensible that elders are financially abused by family members, caretakers, and scam artists. That simply is not acceptable to me. You'll hear today from expert speakers, and I want to thank all of those who are speaking and presenting. Thank you to Taryn Lee Turgeon, the Assistant Director of Protective Services from the Massachusetts Executive Office of Elder Affairs. Also want to thank Attorney Jane Sullivan. I think she's unavailable, but someone will speak here in a few moments. And also to former Representative Michael Festa from AARP, who are all here today. A special thanks to our financial sponsors who have helped provide this great breakfast and other things supporting this conference. They include our platinum sponsor, Commonwealth Care Alliance, who is represented today by Mark Wagoner. And thank you to our platinum sponsor, Fallon Healthcare, who is represented by Deb Davio. Our gold sponsors include AARP of Massachusetts, Bristol Elder Services, Boston Medical Center Health Net Plan, South Coast Health, and United Healthcare. Our silver sponsors include Bay Coast Bank, First Citizens, Federal Credit Union, the law offices of Jane Sullivan, St. Anne's Hospital, and Tufts Health Plan. Thank you to our bronze sponsors, Supernant and Benesky. Again, I want to thank them because without this would not be possible. This event has grown so much during my time as district attorney, and we could not, again, afford to put this on without their support. I want to thank you all for taking the time to come out here, hopefully have an enjoyable breakfast, enjoy the presentations and information that will be provided, and hopefully get something out of this. We have over 70 agencies here to offer resources. And I want to thank each and every one of them who are in the next room for coming here and taking the time to attend and inform our seniors about programs and services that are available to you. I've been to every senior center in Bristol County at least once in the past 7.5 years, and other elder agencies. This is a big issue to me. It's a unique thing we're doing here to protect our seniors, but you deserve it. I said I'd do it, I've done it, and will continue to fight to protect you so you can live as best you can, safety and security of your communities. So thank you for all you've done for us and our communities, and we will continue to fight for you. Thank you very much.
Okay, I want to just quickly thank DA Quinn one more time for putting this event together. As you can see, it's one of the largest events of this kind in this area. So. Our next speaker is Taryn Lee Turgeon. Taryn holds a bachelor's degree of sociology from UMass Amherst and a doctorate from Massachusetts School of Law in Andover. She has been with the Executive Office of Elder Affairs since 2005 and started her position as the Assistant Director of Protective Services in October of 2020. Please welcome Taryn.
Thank you, everyone, for having me here today. I have worked in Elder Protective Services for 17 years. It is the only job I've had, and it is the job that I love. I investigated elder abuse in the field for 10 years, working my way up to a supervisor, a director, and now I'm at the executive level trying to make important changes that need to happen in our program, how we investigate our abuse, and how we provide services. The Executive Office Elder Affairs, we contract with 19 different agencies across the state that take our reports of abuse and concern and investigate them within the field. The types of abuse that we investigate can be investigated by any person who's in the community that is 60 years of age or older. There are no other criteria for protective. We don't look at income eligibility, we don't look at physical eligibility. If you believe you were the victim of abuse or neglect, we will come out and see what we can do to help you. So what do we investigate? District Attorney has said a lot of the allegations that we cover, some of them are legal, some of them are not. We do investigate physical abuse. That can be any physical harm to you, a friend, a family member, threats of harm to yourself or to others that make you feel unsafe. You deserve all the safety and happiness within your home. Better? Thank you. All right, we also investigate emotional abuse. This can be when your family, friends, caretakers, or loved ones are not treating you the way that you're supposed to be treated. And this is impacting how you live, your health, your mental health, and your overall well-being. We look at financial exploitation, where somebody could be misusing your money in your bank account, your assets, your savings, transfers of property, stealing the money that you've worked hard for that you need to survive. We also investigate sexual abuse. This can cover any actual sexual assault, exposure to pornographic material, and harmful personal care practices. I want to make a note that this is vastly underreported. People don't believe that certain people of a certain age could suffer this abuse. It's there and it's real, and we need to look into it. Caretaker neglect. This could be when a caretaker is unwilling or unable, and I want to stress that. There are some caretakers who are just not providing the care that they should be. They're doing it intentionally, and they know what they're doing. This also covers caregivers who are trying, that want to take care of their loved one, that just need a little more help. We in Protective Services can take a look at that and see what we can do to make that person a better caretaker. We also look at self-neglect. I know that sounds a little scary and nobody wants to say that they're neglecting themselves, but that could be somebody who is having difficulty maintaining the house, getting to the store, taking their medication, getting to medical appointments. We want to come in as Protective Services and see what we can do to make sure you can better care for yourself and remain in your home as long as possible. All of these situations, our goal in Protective Services is the least restrictive intervention that we can possibly find. We want everybody to remain safely in their home and in the community. So what our workers are going to do is they're going to go in and they're going to start with you, the elder in the home that's having some kind of problem with abuse or neglect. We're going to talk to you, we're going to get your wishes, we're going to gather some information, and then we're going to come up with the best service plan that could possibly be. We are mandated reporters, and if we find that there is criminal activity, such as financial exploitation, sexual abuse, physical abuse, or caretaker neglect that's resulting in a serious injury or harm to yourself, we're going to help you refer that on to the district attorney. We also look into, as the district attorney said, frauds and scams. We will help you navigate that process. We all know once the money is gone and you're into it, it's hard to get out of it. We will work with you to look into your options, refer to the Attorney General, or wherever is appropriate. Protective Services can sound like a scary thing, especially when we show up at your door. I want to let you know today that we are there to help. We are looking to prevent abuse. We are looking to make sure abuse doesn't get worse and that you can live the best life you can with the services that we can offer. When someone has a concern about any of these situations, you can call our central intake unit, which is 24 hours a day, 7 days a week, at 1-800-922-2275. You can also file online by just going to mass.gov and typing in elder abuse. We look at all reports, screen in the ones that meet our criteria. Massachusetts receives hundreds and hundreds of reports a month that we look into, and it's still not enough. There are still cases that are being missing. There are still elders that don't feel like they know where to turn or who can help them. If you have a concern about yourself or a loved one, and you believe that there's probably something going on, please give us a call. We're going to look into that. And sometimes there's nothing going on and we can just offer some help aside from the abuse or neglect. And sometimes somebody is at risk and we can help their lives a little bit more. Protective Services' big philosophy is to balance an older adult's safety, but also to balance their right to freedom. Older adults have the right to participate in Protective Services and accept the services we offer. If you are alert and oriented and have capacity, you get to choose what services we put in. You get to choose what interventions we offer. It's not that we're going to come in and tell you what to do. If you know somebody who's maybe a little more forgetful or has some cognitive issues, we can be a big help there. Also see what services are going to help and perhaps work to get a family member, friend, or even a professional to be appointed to help make those decisions for them. So again, once we receive the report of concern, we're going to look at what you feel, what your collateral contacts, your friends, your family, whoever you think we should talk to feels is going on. And our goal is to see what can we do to help. So Again, I cannot stress enough that if there's someone that you are concerned about, the only criteria is that you are probably concerned that somebody 60 or older living in the community is being abused or neglected. Please, 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 never feel like you shouldn't report. We are looking to help as many people as we can, and again, prevent and mitigate risk as much as possible. Thank you.
Just want to give you one little tip and make it simple as listening to those remarks. As far as frauds and scams, got a lot of work tables and information here. I'll make it very simple and you won't get scammed. Don't answer the phone if you don't know who's calling. Does everybody understand that? Don't do it. You're nice people. Once you get sucked in, I was at something the other day, group like yours, someone was in the process of giving, and I'm not trying to make light of anybody, $29,000 to Costa Rica. Okay? This stuff happens. Do not answer the phone and do not provide any personal information over the phone. Okay? Does everybody understand that? Okay? Don't do it, and you'll be all set. And by the way, the IRS not looking for you over the phone. You understand that, everybody? They're not going to arrest you. They're not going to lock you up. I know it's startling. And also, your grandchildren are not in jail in Costa Rica. Okay? They're down the street. So, you're nice people. Do not answer the phone. If you do, do not engage them or provide any information. Somebody wants to get a hold of you, they'll get a hold of you. Thank you.
Okay, up next we have Mark Wagner. For over 20 years, Mark has served in a leadership role in both health insurance and provider delivery. He joined Commonwealth Care Alliance in January of 2022 and is responsible for all aspects of the company's operations and performance in Massachusetts. Please welcome Mark Wagner.
Thank you, Justin. Good morning, everyone. It's a real pleasure to be here today. What better place to be, in fact, on a Friday morning in the summer than Westport? And with all of you, of course. A big thank you to Coastline Elderly Services, the Town of Rochester, and the Bristol District Attorney's Office for hosting this wonderful event today. Again, my name is Mark Wagner, and I am the General Manager of Massachusetts for the Commonwealth Care Alliance. We also are referenced sometimes as CCA. For those of you who are unfamiliar with CCA, our organization started over 30 years ago as a small husband and wife physician practice out of Boston that focused solely on individuals with significant healthcare needs. The individuals they served were often left behind or disengaged from the broader healthcare system. Their vision was to provide person-centered care that focused on addressing both the health and social needs of their community. Today, CCA is not-for-profit, community-based payer and provider that serves over 43,000 individuals across the Commonwealth and has earned national recognition for its proven expertise in complex care coordination and healthcare delivery. Our uncommon care model addresses unmet social determinants of health, such as food, housing, transportation, as well as behavioral health and medical needs. It is this model, plus our focus on supporting individuals with Medicaid and/or Medicare health insurance coverage, that sets us apart from typical health plans or other health insurers. Every member who enrolls in one of our plans has a dedicated clinician who serves as their care partner. A care partner is assigned based on member language, location, and other preferences of the individual. So if you have Medicaid and Medicare, or just Medicare, and you're a CCA member, the care partner acts as your quarterback. They take the time to understand your goals, your needs, your preferences, and they work to provide wraparound supports if your needs change, and they work with you to achieve your personal health-related goals. In addition to your care partner, you have a broader CCA care team that can provide additional supports you may need. Those other care team members include advanced practice clinicians, behavioral health specialists, and a broad range of community health workers. The fact that your care partner is a clinician is also important because they understand the health impacts of people's social and lived environments. Given that June is Elder Abuse Awareness Month, it's important to note that your care partner would also recognize that elder abuse can have devastating and far-reaching health consequences. Victims of elder abuse are 3 times more likely to be admitted to the hospital and 4 times more likely to be admitted to a nursing home when compared to their peers with other similar medical or social issues. A CCA care partner would not only ensure that everyone experiencing elder abuse is connected to the right people and resources, but would work with you to mitigate possible downstream health consequences. Our person-centered approach to care is truly our North Star, and it helps guide us through complex situations and certainly helped propel us forward when the COVID-19 pandemic struck. Virtually overnight, our 1,500 person workforce pivoted from a field and office-based activity to remote operations. We didn't miss a beat. We adopted a range of in-person, telehealth, and virtual care technologies, and we achieved over 1.5 million member interactions during that period. In fact, the typical member who has our health insurance coverage during the pandemic received 35 interactions during the year with our care partners and other team members. Despite the significant challenges of the pandemic, CCA successfully engaged with members, improving outcomes as we help them stay safe and independent living in their homes. Over the past year, we have a few interesting statistics to share with you. We have organized for our members, and this is at no cost to individuals that have our health insurance coverage, more than 760,000 transportation trips during the year. We've delivered and had installed more than 76,000 home modifications. These are things like grab bars and include even air conditioners, for instance. And we've actually organized and delivered more than 730,000 meals to individuals during this period of time. Innovation to close critical gaps is actually hardwired into the CCA culture. From our earliest days, we have pushed the envelope to realize our vision of transforming healthcare for those with significant needs. For example, across the healthcare industry, it's been estimated that as many as 2/3 of all emergency departments visits could be better managed in the home setting. This actually led us to establish a new company called Instead. This is CCA's mobile integrated health solution designed to bring urgent care directly into your home. However, closing gaps and truly transforming healthcare does take a village, and it requires recognizing strengths and partnering with similarly mission-oriented organizations, as well as local and state government. Last year, as vaccines first became available, CCA immediately began preparation for how we might vaccinate homebound individuals. Our work to support all members stood out to the Commonwealth. And we ended up actually running the statewide in-home COVID-19 vaccination program on behalf of the state. Through a collaborative effort, CCA teams provided training to more than 10 state agencies, deployed professionals throughout the state, and vaccinated thousands of individuals who otherwise would have been unable to access these vaccines. Our work to support individuals with unstable housing is another example of CCA partnering and working to solve complex problems. Like many American cities, parts of Massachusetts are experiencing a homelessness and substance abuse disorder crisis. To mitigate this issue, CCA was approached again by the Commonwealth of Massachusetts to create a first-of-its-kind temporary housing community on the former Shattuck Hospital campus. CCA is now managing 18 cottages, serving up to 25 guests at a time, providing an array of health and human services to these individuals, with the goal of helping these guests transition to permanent housing and maintain access to their health care services. It is our commitment to innovating and never stepping away from complex problems that's made CCA OneCare program, which is our health insurance coverage for individuals who have Medicare and Medicaid and are 21 to 64 years in age. This OneCare program is now the fastest growing Medicare/Medicaid program of its kind in the nation. And our CCA Senior Care Options program is our health insurance coverage for individuals who also have Medicare and Medicaid and are 65 and older. And this program is actually nationally recognized and scored a 5 out of 5 star rating from the federal government, the Centers for Medicare and Medicaid Services. We continue to deepen our commitment to Massachusetts every single day. This year, we introduced Medicare Advantage health insurance plans designed to serve those who narrowly miss Medicaid's threshold for income or assets. Additionally, in October of 2021, we announced a new partnership with South Coast Health, the largest provider of primary and specialty care, serving communities across southeastern Massachusetts and Rhode Island. This new relationship or partnership gives CCA members access to more than 700 providers at South Coast primary care practices in their 3 regional hospitals. We are very proud to be a platinum sponsor of today's event and excited to serve our community here in Bristol County. Thank you all for your time and continue enjoying your breakfast. Thank you.
Okay, up next we have Deb Davio, who is the Vice President of Medicare and the Executive Director of Navicare for Fallon Health. She has more than 30 years' experience specializing in supporting older adults and individuals who receive health care coverage through both the state Medicare program and, Medicaid program and Medicare. Please welcome Deb Davio.
We all need a little help sometimes. Good morning. It's great to be here with all of you today. First, I would love to thank the DA's office, Coastline, and the town of Rochester for inviting me here today. I always love coming to these events and meeting people in the community, and that's true now more than ever. At Fallon Health, we are privileged to serve individuals, many of them older adults like yourself, in communities all across our beautiful state. And of course, we have a soft spot for Bristol County. We have been improving health and inspiring hope for 45 years and are deeply invested in the diverse communities that we serve. From providing funding to help fight food insecurity and social isolation among older adults, to volunteering and organizing flu clinics, such as the ones we held in New Bedford and Fall River over the winter months, we are proud to help make a meaningful difference in the lives of our members and the greater community. In our line of work, empowering older adults is a major focus. We recognize how important it is to you that you live as independently as possible. In fact, a recent AARP study found that 77% of adults 50 and older want to remain in their homes for the long term. And we hear you. And this is an area Fallon has a lot of experience in, and that we take great pride in helping you accomplish. Fallon Health's Eastern Mass team, made up of Jersey Capataz, Linda Correa, Andrea Ferreira, and Sandra Amaral, all who are here today and who live among you in the community, are great resources, and I encourage you to reach out to them to ask about our programs. I know it's been a hard few years for all of us, and I'm so grateful that we are getting to have this celebration together and in person. I hope that you're able to make some great connections today and utilize all of the resources that have come together for you. On behalf of Fallon Health, thank you so much for your time, and have a great rest of your day.
Next up, we have Michael Festa, Mike is the state director of AARP Massachusetts, based up in Boston. In this role, he leads the development and delivery of AARP's community programs, advocacy, and information for more than its 800,000 older people in the Commonwealth. He has a proven track record of fighting for Massachusetts residents. He holds a Juris Doctor from Suffolk University Law School and has held many leadership positions and executive positions over his career. Please welcome Mike Festa.
Good morning, everybody. I don't know about you, but I'm a little dragging because of last night's Celtics game, okay? I'm throwing it out there. The fog didn't help. I come from Melrose, the drive didn't help. But it's great to be here. I don't know about you, but doesn't it feel great to be together as a crowd? It's been too long. And, you know, as I was listening to these wonderful speakers and looking out at the audience, I want to congratulate you for paying attention. I understand that you're getting a lot of information, and it really can be a challenge, right? I mean, there's so much going on that we need to pay attention to. And I want to assure you, I'm not going to take too long, but I'm going to plunge in and give you a sense of what AARP has been up to lately that I hope you'll agree is of value to you and to your neighbors and friends. You know, there's been a lot of talk, and first of all, I do want to acknowledge, Tom, what a great DA you have, and he's now the president of the DA's Association of Massachusetts, so congratulations, Tom, for that. And of course, Coastline and the town of Rochester, great sponsors, great people. We've been talking about fraud a lot this morning, haven't we? And frankly, the reason is that we could be coming back 20 years from now. I won't be around, but 20 years from now, somebody's from AARP is going to remind you not only not to pick up the phone, but maybe not to drive that driverless car or something. I don't know. They're going to be talking about things we don't even know about. But the constant theme is we've got to acknowledge that we can be vulnerable to the scammers and the schemers and the fundamentally black-hearted people who think nothing of taking money from vulnerable folks. And that's just the way it is. So the good news is, like Tom said, we have control. We don't know these people, we hang up. If it's your daughter or your mother, well, you know them and you better pick up. Unless you're really mad, in which case you're going to pay a price for that. But suffice to say, common sense, sometimes we lose it because, you know, they call this psychologically getting your amygdala hijacked. You know what that means? It means that the scammer goes right to your emotional underpinnings. Why do they say IRS? Who likes the IRS? Anybody around here like the IRS? Unless you work for them. So you immediately, oh my God, my granddaughter's been arrested, oh my God, right? So before you know it, you're giving away things that you shouldn't be doing. So that's important. Now AARP is very involved in fraud prevention. I have with us today, by the way, and I hope you visit the booth in the back, AARP has our leading expert on fraud prevention, Dennis Hohengasser, and who goes around the state and does presentations. All of this, of course, is for no charge because we want to be sure that people get good information. But I want to spend just a couple of minutes to tell you about a different subject area. And this is our advocacy priorities. You know, AARP, frankly, is probably the most powerful lobby group in the country in Washington, next to another organization who has 3 letters and not 4. I don't even mention them. But I will tell you something about AARP in Washington. We are focused on acknowledging that right now the cost of prescription drugs, and have been for a long time, out of control, and we've got to stop the government from making it illegal to negotiate Medicare prices for prescriptions. 44 million people get Medicare. Thank you. 44 million people get Medicare, and it's illegal for Medicare, the government, to negotiate with Big Pharma over the cost of those prices. Is that ridiculous? Well, I'm going to tell you, it may be ridiculous, but we're not, frankly, mincing words. Big Pharma has a lot of control in Washington. They pay a lot of money to lobbyists. They spent $110 million on lobbyists last year. They're lying to you, and I'm going to be very blunt about this. They're lying to you. They're saying, hey, you take away negotiation, or you make us negotiate, we're not going to be able to do research to protect you and to help you. They spend 19 times more on advertising than research. So let's be real. AARP is trying to get across the finish line a very important piece of legislation. We're down to that one vote. He's from West Virginia. He's driving me crazy. We love him, but frankly, it's a problem right now. We have got to get that passed so we can reduce the cost of prescription drugs. That's our number one priority at ARP. And I hope, by the way, you've got a great congressman here. You've got two great congressmen in this area, both of whom have been fighting hard to support the position to allow negotiation. This is also true of Senators Warren and Markey. So, you know, it's not a bad idea if you have a chance to shoot them an email, make a phone call, thank them for being your voice. But we need every vote, and we right now are down to one. Hopefully this will be done in the next few, actually it has to be done in the next month. So if you have any time, do it. Now the last thing I want to say is about state legislation. ARP does a lot of work in Beacon Hill. I'm a recovering politician, which is why I'm really enjoying standing up here. I miss this. But the thing about Beacon Hill is they take their time too. We've been struggling to try to get some bills across the finish line, and I want to just highlight what they are. The one thing we learned about this pandemic for the last 2.5 years, and it's a tragedy that never should be forgotten. Think about those veterans in Holyoke. Think about the nursing homes and the reality that 95% of the people who died from COVID were over the age of 50, 85% over the age of 65, and the vast majority in long-term care settings. We have not forgotten that. We are fighting for legislation that puts focus on nursing home practices. We don't like the idea that you have 3 or 4 people in a room. We think it's wrong. We think it lacks dignity. We're fighting to reduce the number of people in rooms. We're fighting for transparency. We want to make sure that these facilities are prepared for the next pandemic. This is a fight that has to continue. And right now, as it turns out, luck would have it, my former colleague, who happens to be the Senate Chair of Ways and Means, the bill to reform nursing homes in the way I've now described is in Ways and Means. Now it's on the House side. But our good Senator Rodericks would love to hear from you. So you might want to reassure him that you haven't forgotten about those people either. And we've got to learn those lessons, and we've got to change policy. So that's very important. The last thing I want to say to you has to do with caregivers. Now, many of you in this room, I'm sure, are caregivers for your own loved ones, or you are being cared for in some way. The average caregiver in Massachusetts, we did a study on this a few years ago, spends over $7,000 out of pocket to help people stay at home in all kinds of different ways, coming up with their own money to pay for a private caregiver if they don't qualify under the home care program. There's all kinds of money being spent. We have a bill that would give a tax credit of up to $1,500 for any caregiver who provides that care, and it's a matter of filing a form, which you would do as part of your tax return. We think that's a great idea. I'm happy to tell you it was reported favorably out of committee, but it isn't yet law. And so if you happen to remember this too, if you're a caregiver and you care about this kind of an issue and you really could use that up to extra $1,500, mention this to legislators that represent you and ask them to get this across the finish line. So that's a lot to talk about. I hope you remembered at least some of it, but I'm going to leave you with another thought, last bit of information. To get to AARP and all the information we provide, we do a lot of different programs in the community. We do a lot of advocacy. The easiest way to find out what we're up to and whether you want to participate in some way, but mostly just to get information, you go to aarp.org. That's it, aarp.org. And if you want to know about Massachusetts, put /MA. And that'll give you a window into all the stuff we do. So listen, thank you for your attention. Most of you have not slept through my speech, and I want to thank you for that. The breakfast was great, and we love you all. So stay safe and have a great summer.
Okay, everybody, our last speaker today is attorney Michelle Boneski. Michelle has decades of experience practicing law, with her focus being on estate planning and other elder law matters. She's based in the South Coast and serves many clients in this region. And Michelle also currently is serving as the president of the board of directors for Coastline Elderly Services. So please welcome Michelle Boneski.
Thank you. I appreciate being here. On behalf of Coastline, I want to thank District Attorney Quinn and all of our sponsors for being here, and thank you all for coming. I will be very brief. I know I'm standing between you and the resource fair. Elder abuse is sadly not uncommon, and there are many, many resources out there. I would encourage you to reach out to anyone, whether it's the district attorney's office, Coastline, your local senior center, anyone, and they will get you in contact with the right person. I am here to talk about elder law and estate planning, which could be a full day symposium, so I'm going to keep it really short. As we age, sometimes we need a little more help. We've talked about that. And the two most important documents that everyone should have, one of them you can get for free on the internet or through your local doctor's office or hospital, is a healthcare proxy. I want to stress, because I hear this with my clients all the time, these documents do not take any rights or powers away from you. This is a just-in-case document, and a healthcare proxy names who would make medical decisions for you if you're not able to make them for yourself. And I recommend that you have a backup on that as well. And you can get this form for free. You just want to make sure you fill it out correctly, and whoever you have witness it, you need 2 witnesses, it's not related or the person that you named. Extremely important. If you do not have a healthcare proxy and you're in a car accident and you're in a coma, your family is going to have to go into court and get what's called guardianship of you, which does strip you of your rights. And it's a court process. It's time consuming and expensive when somebody's sick. So if you don't have a healthcare proxy, please get one. It really could make a big difference to you and to your family if you're ever ill. And the second most important document that I stress to everyone is something called a durable power of attorney. And this is a document that lets someone else handle legal or financial things for you if you are ever unable to handle them for yourself. And usually you do need to get one of those from a lawyer, but it's not usually thousands of dollars, it may be a few $100s. It's so important. There's also pro bono legal services out there that might be able to help you get one. But if you do not have a durable power of attorney and you get sick, your family has to go into court and get what's called conservatorship to be able to access your bank accounts, pay your bills, things like that. And that can cost like $5,000, and it can take a lot of time. And again, this is when you or your loved one is sick. So to avoid the court being involved in your processes, a durable power of attorney and a healthcare proxy are the most important documents, in my opinion, that you can have, and everyone should have them. And there are a lot of resources in the community that can help you get one. And I would encourage you, for the good of your family and for yourselves, to do that. We have a booth here. I know there's another elder law attorney here. Coastline is here. There are so many resources out there. If you have questions, please stop by, ask questions. AARP, everyone can answer a lot of different questions for you and point you in the right direction. So thank you for coming. I promise to be brief, and on behalf of Coastline, thank you for being here.
All right, I just want to quickly wrap things up. That was a lot of information, and you will see a lot of information next door at the resource fair. And I think the takeaway for you should just be that you can see, based on everybody attending, there is a huge network of dedicated professionals that are here to advocate for you, support you, and protect you. So please keep that in mind. And thank you, and enjoy the fair.